women are more elusive, right? They're not as easier to read as men.
Do you mean that?
In a good way. In a good way.
Yes.
The bad part of that is that their symptoms are ignored. Because for males, it's, I have chest pain. Okay, this is what we do.
Your standard, like,
Your
heart
standard
attack.
chest pain. For women, it could be anything.
The following podcast is a Healthy Dog production. Welcome to the Healthy Dog Podcast. I'm your host, Dr. Nigma Talib. I'm a leading naturopathic doctor now for over 20 years, and I've consulted thousands of patients with chronic illnesses. I've had clinics all over the world, and I have a #1 bestseller, Younger Skin Starts in the Gut. Listen, I know there's a lot of health information out there in the health and wellness world, and it can be a bit overwhelming. So I'm here to set the record straight and give you my expertise along with my expert guests here in studio in sunny Los Angeles.
I only take drugs with other people who take them on a regular basis because I don't have time for that.
A lot of chronic diseases stem from mitochondrial dysfunction.
Yes, and you know what I love talking about, right? Poop.
Yes. You can ask me about my poop?
Yeah, I'm going to talk about poop.
Okay, please.
This podcast is your go-to for achieving optimal wellness from the best of beauty and longevity and everything in between, because after all, wellness comes from the inside out. Welcome back to the Healthy Dog Podcast. I'm your host, Dr. Nigma Talib. Today, we're talking about an organ that holds everything together, your heart. Here's a truth most people don't even realize. Heart disease is the #1 killer of women, taking more lives each year than all cancers combined. And yet women are routinely misdiagnosed and undertreated and told that their symptoms are just stress. That's why I'm bringing on someone I personally trust with my own patients. Today, we have a board-certified cardiologist with a background that's as accomplished and unique as he is. He was born in Atlanta, studied at Emory University and the Juilliard School of Music, and he completed a dual residency in internal medicine and pediatrics and served as resident physician for Houston Rockets. He later completed cardiology fellowship at the world-renowned Mayo Clinic. He's now based in Beverly Hills, and he treats my patients, and he is an incredible cardiologist, and he also works in the area of preventative cardiology. I'm so excited to welcome my very good friend and cardiologist and the doctor I refer all my patients to, Dr. David Filsoof. Thank you, David, for being here today. You're a trusted friend. You're a doctor I send all my patients to, and thank you again.
Thank you for having me. It's a pleasure and an honor.
I want to talk about, because we've talked about this before, what brought you into cardiology? Like, what makes somebody want to be a cardiologist?
Right. I actually didn't plan on being a cardiologist when I went to medical school. I originally was going to be an ear, nose, and throat surgeon. And why? Because I studied music when I was younger. I was at Juilliard for my music education. And I really, I wasn't going to go in professionally for music. So I said, what could I do with medicine that would tie it together? And I thought ear, nose, and throat was the first thing I was going to do. And then when I was going through medical school, I started to notice I liked taking care of people long term. I didn't want to just do procedures and then that's the end of that. I wanted to take care of someone, longitudinally, get to know them and make an impact and see their progress. So I switched over to something that's less, procedural and more management. And so I liked cardiology because I liked listening to the heart sounds, the murmurs, the rhythms. It really tied into my love for music and love for piano. So it was a really good mesh of the two.
Yeah, I mean, because it is a completely different subject. I guess the lub-dub has got some music to it after all.
It's all a dance.
It's all a dance.
All a dance.
Because, as I said, heart disease is the #1 killer. It's really, really incredible. And in particular for women, it supersedes all cancer risks. And I don't think a lot of people know that. And so my question to you is, this field of medicine doesn't seem to be impacting the way it should be. I'm seeing more and more women with cardiopathologies. As you know, I send everyone to you to have a overlook at the heart. Why is this on the rise? Why is if the area of cardiology is so important because it is the number one cause of death? What's going on with this field? Where are we losing the plot?
Yeah, we're getting really in a good way. We're getting better at diagnosing and managing. Where the technology is pretty amazing right now, and the treatments are getting better and better. But I think where we're falling short is people are not getting checked out in time. They're waiting too long. They're waiting for something to go wrong when they seek attention. I think we're not doing very good with prevention. I think we're just focusing on wait till you get sick and then see the doctor. And I think that's where you come in really well. You look at a person as a whole and you see, how do I keep you healthy rather than what do I do when you're sick? I think that's the key here in our society is get ahead before it's too late. And that's why we're not doing a great job. All the focus is really on cancer right now. Because it has a lot of press, because it's very debilitating, it's very depressing to see. And heart disease kind of just got pushed to the side because it's just, cancer really, it's got all the attention. But we're here today to really educate people and tell people, look, heart disease is real, it's still the number one killer, and you really need to be educated about it and know when to seek help and be proactive about it and not just wait when you have symptoms. You know?
And yes, of course, an ounce of prevention is worth a pound of cure. We hear that all the time, right?
Exactly.
But, as naturopathic doctors, we don't just prevent, we treat, like we're chronic repair doctors. So we're chronically repairing and treating anything that's chronic. And I feel like that's the missing link.
Exactly.
Is that you said you want to treat people longitudinally. You want to treat them for a period of time, the chronic, because cardiac issues are long-term. This is not something you're going to get a pacemaker and then you're fine.
And then you're done,
right? You've got to keep up with the certain medications, the diets, supplements, which we're going to get into later. But, the chronic aspect of treating cardiomyopathies are missing, because there are so many other dimensions to that. So it's interesting how I feel like for me, that's the missing piece, I think, and that's why I send everybody to you. So the other thing, I'm just going to go right into it because there's no wasting time here. You know what a big fan I am of statin drugs. I'm not a big fan, actually. I find them, really debilitating for patients and not really looking at the root cause. Let me ask you, first, let's start off with people listening. What is a statin drug?
Okay. This is a great topic, and I'm glad we're going to do this. Statin is a drug that has been around for a while, and it is the, largest prescribed medication in the history of our, pharma. And its emphasis is to lower LDL cholesterol, the bad cholesterol. That's really all it does. And my concern and my criticism with it is it's become a knee-jerk reaction medication. What do I mean by that? If someone comes and sees you and they have high cholesterol, they automatically get prescribed the statin. There's no thought with it.
Yes.
They're not looking at the patient as a whole and how it ties into everything they're doing. It's just sort of high LDL, let's put you on a statin. Why is that a problem? You're going to be on this medicine for the rest of your life. Forget about the cost because they're relatively cheap now. You're going to be on this forever. Most people, when they start a medication, they rarely ever come off. And one of the criticism I have with most doctors is they're really good at starting medications. They know when to start things, but they don't know when to stop them.
When to take
and
them
when
off,
to taper off, and when do you need it and when do you not need it. So chances are, if you're going to get a statin prescription, you're going to be on it for the rest of your life. So I tell everyone that's a commitment. Do you want to put yourself through that commitment, or do you want to give yourself the chance to see if you can get these numbers down on your own with the right supplements and the right lifestyle changes? So my problem right now is this knee-jerk reaction. Now, I think you want to go a little deeper and talk about the cons of even being on a statin once you've been prescribed, because it still does what it does, and it does help certain people, and it has its role. But most of the patients we see together, they complain about muscle aches, muscle fatigue, myalgias, and their exercise capacity may change because they're sore. It can cause some disruptions in their vitamin levels. It can impair glucose metabolism and potentially even cause diabetes. There's some role with dementia. So there are some side effects and there are some risks associated with it that people are not really attuned to, and they just focus on getting this one number down. And we're going to talk about that number and how it plays a role with heart disease and how it's not as important as we thought it was. So I'm thinking now we should rely less on statins and some other things that are available.
Yeah, I mean, I've seen patients on statin drugs with brain fog, mitochondrial dysfunction, coenzyme Q10 reduction. And we know that through, there's so many clinical studies, we see it with patients, and these are debilitating. When you reduce mitochondrial function, you reduce
You're exhausted. Yeah.
Right. If without the mitochondria, we're basically dead.
Right.
And so it's an interesting a struggle I see and a dance I do with a lot of cardiologists where, I want to look at the root cause, because 50% of people who have a heart attack have normal cholesterol. I mean, that's a pretty alarming statistic. So if we are focusing on statin drug medications to reduce one marker, which is what you said, LDL, we're not getting the whole picture.
We're not. And there's a lot of pressure on medical students and early doctors to prescribe this. It's pushed in the hospitals. It's part of something called a core measure, where if you're hospitalized and you had a heart attack, you need to be on a statin unless proven otherwise. So it's like almost mandated. And it's a lot of pressure on doctors who don't want to do that. We have to now justify why we're not doing it as opposed to justify why we're doing it.
Wow.
So that's the difference. So the pressure is on. And you almost look like you're a neglectful doctor if you're not giving your patient a statin. Now, there are lots of published data, research. The community on a whole is aware of the downsides of statin. They're aware of it. They know about it. They don't want to talk about it. And the caveat is, well, despite these risks, the benefit outweighs these risks. So the saying is that the reduction in heart attack and heart disease justifies being on a statin against all the pitfalls. But I don't think that's right. I think that's what they're just selling us. Because it's easy, it's cheap, it's widely available. Just give everyone a statin and call it a day. It takes no thought. Anybody can do it. Done. But if you want to put effort, emphasis, really tailor your treatment plan and individualize it, I really don't go straight to a statin.
I've built my entire clinical philosophy and even wrote a book called Younger Skin Starts in the Gut around one simple truth. If your gut isn't optimal, nothing else works. Genova Diagnostics GI Effects Test is the gold standard in functional stool testing, mapping your microbiome, digestion, inflammation, and nutrient absorption with clinical precision. It's a crappy job, but someone has to do it. And no one does it better than Genova. Visit genovaconnect.com and use my code HEALTHYDOC15 for 15% off your first stool test. What are you using right now?
So when I see someone for the first time, depending on their age and their risk factors and where they're in their life, I don't even bring up statin. And they may bring it up to me and I say, no, let's not do that just yet. Let's wait. So I'll try supplements, a lot of supplements that you have, the red yeast rice, the CoQ10, the fish oils. I'll try all those and I'll give it a few months, maybe 3 to 6 months, and check some markers again. I make sure that, they're doing all the things they're supposed to do without a doctor, the exercise, the stress reduction, the proper sleep and meditation, just lifestyle things, getting enough sunlight, just getting out there and living healthy. That's the first step. And I was actually thinking of that on my way here to see you today. I said to myself, statins have only been around for X number of years. What did people do before that? I mean,
Right.
medications were not even around 100 years ago, and people lived, their life expectancy. So why all of a sudden do we have this obsession with prescribing medications and prescriptions? What is this? So I noticed, and we talked earlier about the food is our killer. I mean, the minute you eat something, you're hurting yourself basically with processed foods and altered foods and fatty foods. So if we kind of change our diet alone, I think that would be much more valuable than looking at medications. I think medications might be the lazy way out. So I first try to tell everyone, look, these are the 4 or 5 pillars you have to do to lead a healthy life. If we can get you there and you're consistent with it and you have discipline, then we don't have to use any medications. Medications are not supposed to be, it's supposed to be a last resort, not the first step.
Right.
So that's what I really admire about you, because you are very adept and very knowledgeable about not using these things. If anything, they're poison. But it's easy to give the whole population, the mass population, a statin than to spend 2, 3, 4 hours discussing about lifestyle choices.
Who has time for that, right? When you have 30 patients a day, your way to get the patient out of the room is actually write a prescription so you can hand it to them and they can then walk out.
Exactly. And then go to the next and do it again and repeat. And then
I think the system has set you up for failure. It
sets you up that way.
And the patients also set you up for failure, because we have to put the onus on the patient as well, because they want a quick fix. They want something that's going to, because people are very competitive with their lab results. They want to
they want to treat the number.
They want to treat the number.
Right.
They want that. I have so many patients that are so cute.
Obsessed with the number.
And she's obsessed with her number. I mean, of course, the CRP, the inflammation marker, I agree. I'm obsessed with that number to a degree. But they are obsessed with the number. And when you can give a drug and you can see a number change on a lab result, it's kind of...
But the number's designed to get you to take the medication. Okay, this is very important, guys.
Yes.
You have to take these numbers into context of you as a person and not as a population. When they say your cholesterol's high at 130... what does that mean? I mean, it might be high for one person and really low for another.
Exactly.
So the cutoff is not real. It's just designed to get the most number of people to take the most number of medications.
It's so true. And the other thing is, if we think about it, we want cholesterol. Cholesterol is actually the precursor to our sex hormones. So those out there who want good libido, buy to that if you're on a statin, because that's going to get rid of your
among other things.
Then you're going to be put on other things like Viagra and God knows what else. So it's like, it's just a drug to put you on another drug. And deplete other, key nutrients. Like, I talked about coenzyme Q10. How important is CoQ10 in the heart?
Very. It's one of the fuels for the heart. And I always give that option to patients to start that as soon as possible. So yes, that's one of the go-to supplements, absolutely. And people don't know about it, surprisingly enough. It's sort of just in the Whole Foods vitamin section, but nobody knows what it's for or what it does. So interesting. But I love that you educate your patients about that and you really hit that one hard. Okay, so CoQ10 needs to be a star on that one, and everyone should have that in their medicine cabinet.
But do cardiologists as a whole, like if you look at your colleagues, do they know that a statin drug actually reduces coenzyme Q10 levels along with mitochondrial damage? Do they know that, or are they not?
I don't want to speak for other people, but I would say on a whole, it's not really talked about. It's not like on the tip of my tongue of, I'm going to start a statin, I better
get on some CoQ10.
But, we know about it. And if you have a cardiologist that cares and takes the time, they need to educate you about it. But like you said, we're all in a rush and we just want to get out the door. So take the statin and move to the next one is sort of the way it looks like,
How much nutrition training do you guys get in cardiology?
That is really sad to admit. Maybe a few weeks.
Wow.
So any nutrition training a doctor gets, it's sort of on their own postdoc. After they're done with their training, they kind of tailor their practice. But sadly, no, it's mostly pharmacology. And I'll make an admission to you, and I'm really sort of embarrassed to say this, but sometimes when I come to work, I ask myself, who am I really working for? In the end, you're working for the patient, right? You're here to serve the patient and do best for the patient. But sometimes I feel like I'm working for the drug companies. Think about that for a second.
Wow.
Sometimes I feel like I should be on salary for some of these drug companies because that's really what we're doing. We're just prescribing things. And there's so much of pressure on doctors to prescribe things. And thankfully, the way it's done has changed a little bit where, doctors cannot get, gifts and bribes, I guess, to prescribe things. But still, there's a unspoken pressure, the drug companies will come and they'll look at your quotas and your numbers and they'll ask you, why haven't you prescribed this? What's going on? Is there anything we could do to, change that? So sometimes I come to work and I'm like, I forgot that I'm working for the patient. So, you have to keep that in mind, that we have an oath to the patient and you need to do what's best for the patient,
And that's what I admire about you so much, is that you really do practice like a doctora, which means teacher. And you're always teaching your patients, what to do, why to do it, things that they don't need to take. Are there any good drugs out there, David? Like, are there good ones for...
I don't think there's such a thing.
There has to be some.
There's such a thing.
Well, drugs do save people's lives. I mean,
Yes.
there are drug medications that people need to be on.
Absolutely.
So if somebody has a really they have endothelial lining damage, right? Which is damage to your blood vessels, for those listening. That is the most, that's the highest risk factor for you then getting arteriosclerosis, which is clogging of the arteries, which then can cause you to have heart failure. But the key is how do we get those arteries declogged? Right? Is there something out there that's new, upcoming?
There's drugs, but not supplements that I could think of.
Drugs, yeah. Are there any good ones that are you see coming up that you're working with and you're like, you know what, this is not creating side effects. This is actually moving, helping with endothelial function and, endothelial growth factors is there anything like that happening?
There's a few things. It's an exciting time. What's very important to know first is what's part of normal aging.
Sure.
And what's actually a disease.
What's part of normal aging? I don't know.
Exactly.
I'm going the other way, I hope.
We all want to age backwards.
Yes.
And I think a lot of people get nervous and, we get older and that's a normal thing. That's not a disease. So you don't treat that. We're all going to have some degree of fatty streak is what we call it, or the arteries getting a little harder. A lot of us will get some calcification in our arteries. That's all normal. And you don't necessarily have to treat that. It becomes a disease when, one, it's premature, or two, its burden is beyond what you would expect for your age. So like a 40-year-old with a lot of plaque is concerning versus a 90-year-old who has a lot of plaque. So
of course, yes.
There are different scenarios there. So what do we have now to treat plaque? There's a lot of research with antibodies, monoclonal antibodies, that have shown promise in reducing plaque size and plaque progression far better than a statin could ever dream of doing. Okay? So if I had to pick a drug or a medicine, I usually will shift focus on monoclonal antibody therapy. Because there's really no significant side effects or drug interactions. It's clean, it works fast, it's safe. So I think you'll be seeing a lot more research, development with different ways of taking medication. So most medicines now are starting to become injectables.
I was just going to say that, because isn't that an injection?
Yes. So most things are being taken injectable. It bypasses the metabolism and stomach. It doesn't interact with your food or with other medications, and works more efficiently and faster.
Kind of like good old Ozempic.
Exactly. Ozempic.
I was going to sing the
get
Ozempic
into that
commercial.
too. Yeah. So don't be surprised if most medications are delivered differently.
Interesting. Yes. I mean, For my patients, I'm delivering a lot of medications. They're taking peptides via injections,
Right, IV therapies.
IV therapies, CJC and epimorelin. I'm giving along with GLPs, so peptides along with GLPs to support the metabolism. And then eventually wean them off the GLPs. But we're going to get into that after I ask you this question.
Okay.
True wellness lives in the smallest details: the air you breathe, the water you wash with, and the surfaces you touch. That's why Koala Eco, with their beautiful botanical ranges for home, laundry, body, and even pets, is the only brand I trust. Elegant living without compromise. Visit koalaeco.com. That's KOALAECO.com and use my code HealthyDoc15 for 15% off your first order. I wanted to ask you, we touched on LDL being a boring blood work. What are some blood panels that you're using that are different than other cardiologists?
Sure.
I know I always send you a list of blood work I want my patients to get when they come in to see you. And you've never, ever once you're probably the only doctor that's never complained.
Maybe not to you directly.
Oh, no.
There's a lot. So a lot of times we'll see patients and all they have is their lipid panel, which is just your LDL, HDL, total cholesterol. And that's sadly not a full enough picture of what's going on. And you alluded earlier that you could have high cholesterol and no disease.
Yes.
So how do you make sense of that? Or you could have perfect cholesterol and you can have a lot of disease. So how do you make sense of that? So there's more to it than just LDL cholesterol. So I don't even mind if we don't even check that anymore.
Right.
Who cares at this point? So you have an excellent cocktail. You have an amazing protocol that should be standard of care. And then at the end, people are going to ask, well, why isn't it standard of care? Why isn't Dr. Nigma's protocol standard of care? It all comes down to what insurance is willing to cover. And these become very expensive. And it takes a lot of thought and effort and energy to order these and interpret them and do something about them. So it's just easier to check an LDL and give a statin.
Right.
But some of the ones we do, the lipoprotein A, that's gotten a lot of press. That's a very important one, if not the most important one to check.
Do you know, I've been using that for 20 years.
Amazing.
That marker, when it first came out, I remember sending my patient to a cardiologist and the cardiologist saying, this is ridiculous.
Don't know what to do with it.
Marker
Yeah.
means nothing. And this patient was high risk for heart disease. All the cholesterol levels were normal. And the patient had a heart attack exactly a year later.
That happens.
Because he listened to the cardiologist.
Yeah, that happens.
Yeah.
Sadly.
So let's talk about
So get that
lipoprotein.
checked.
Yeah.
Then there's apolipoprotein. There's the inflammatory markers, the high sensitivity CRP you like. There's the oxidized LDL, which is more valuable than regular LDL. It's the inflamed
Yes.
LDL.
I know you said you liked that one too. That I
You want to check insulin levels. You need to just put it on your podcast, the list. That you should make that
Yes,
list
I'm
available
going
to
to.
everybody, so they
Let's
can
do that.
Yeah, ask for it and see what it is. I think it's because there's hundreds of them. We can go on, and I don't want people to get confused with all of them. But there's at least 20 or 30 things you can check.
Homocysteine being
That's
a
a big
really
one.
important one.
Yeah, that's a good
Let's
one.
talk about homocysteine.
You love
homocysteine
this
for a
one.
second.
You absolutely love this one.
I am obsessed with homocysteine because this marker is such an inflammatory
It's
marker.
an inflammatory marker.
Not
right.
just for the heart, but also for the brain.
The whole body.
The whole body, it causes so much oxidative stress. And now a little bit of homocysteine is okay. But when you see a massive amount of breakdown of methionine, which is an amino acid, and you get homocysteine from amino acids, from especially people that are on very high protein diets, those are the people that need to check this one marker.
Yep, and they don't know to check it.
And they don't know to check it. And if it's high, like if it's above 7, for me, that's no bueno.
Yeah.
You know, I think the marker is like over 15, but that's like already far too gone. So some of the things that really help reduce it are like B12, trimethylglycine, 5-MTHFR folate. So all of these vitamins, which is in one of my B vitamins that I sell at Air One, which I love talking about.
It's a beautiful vitamin. Yeah.
It's a really good product because, and there are similar products on the market You don't have to get mine. But, there are similar products on the market that have those B6, B12, methylcobalamin, methylfolate, and trimethylglycine. Those are like
You've made it easy for them, okay? That's all they need.
It's all they need.
Because it does get confusing. Where do I go and what do I get? Because when you get a prescription, that's your prescription. Easy, no thought. But if you go to like Erewhon or Whole Foods and you're trying to pick a supplement, I don't even know what to pick. You made it easy. You have it all in one place. Yeah. It does what it's supposed to do. It's clean and it's right there in front of you. So if you have doubts or you don't know where to go, Dr. Nigma has it tailored for you perfectly.
Wow.
So easy.
Look at the testimonial.
Yeah, no, it's great. It's there. It's in there. The ingredients are all there and it's clean. So that's an easy one, that should be the standard supplement of choice.
It should be. And, people are taking folic acid. They don't know that folic acid is actually harmful to you. You need to get the methylated folate.
Exactly. And you have that. So
yeah. And it's important. Yeah. Because about 30 to 50% of the population have methylation defects. And we know that also messes up hormones for women badly. Like we're not able to get rid of the bad hormones out of our body if we don't have this methylation. So you have someone on HRT, hormone replacement therapy, and they're like, okay, it felt good for 2 months, but now I'm feeling anxious again. I'm not feeling well. It's because you're not getting the delivery of those HRT into the cells because you're having all these methylation defects. So those are also good for, hormonal issues. Okay, so we've talked about LDL, more than LDL. We talked to homocysteine, lipoprotein A, ApoB. Any other ones? HSCRP.
High sensitive CRP. There's ESR. There's like fibronectin, adiponectin. You can check your leptin levels, your insulin levels, your cortisol levels, your stress hormones. The list goes on and on. And I don't expect patients to come and ask for this or know about it. That's why it's really good that you have a standard protocol that you just check so you don't miss anything. You just know that these are the things that should be done at least once a year, and then you have a better picture of what's going on.
I have a question for you. Women and men different in cardiology, correct? It's like a different
The yin and yang.
species.
Yes, they're different.
So
Different beasts.
different beasts, right? And yet they're put on the same dose of medication
That's
as
a
men.
good point. That is a good point. We're not good at dosing things. I think you need to dose for weight, gender, and age, and kidney function and liver function. And that's a big problem. So if I'm going to do something, I'm going to give the lowest dose possible first and then titrate up. I don't think there's anyone that has any specific rules of how they do that. I've seen people start at the highest dose and then they have side effects and then they come off the medicine and that's the end of that. So that is a very good topic of how do you dose things. And I think we're not good at that. I think everything's sort of standard from the age of 18 onwards. We do it for kids. I don't know why for pediatrics, because I also train in pediatrics. So I'm technically a pediatrician, but I don't practice that. And when I see young kids, I dose it for their weight, right? I dose their amoxicillin or their Omnicef according to their weight. And then once they hit 18, I mean, an 18-year-old who's 100 pounds or 250 pounds is the same dose.
Right.
So why is that? But if they're 16 and 100 pounds, you'll dose it. So it doesn't make any sense.
Yeah.
Something about when you're 18, it's all the same dose. Doesn't matter how much you weigh. So that's something we need to be better at. That's a great point.
We talked about at the beginning of this is cardiovascular disease being the #1 killer in women, passing all cancers.
The neglected gender for heart disease.
Neglected gender
Right.
for heart disease. What if for those women listening, and of course I'm over the age of 40, I'm 52, people in my age bracket and older, even in their 40s, what do we need to know? What kind of signs and symptoms should we be looking for that are different than what men are looking?
Yeah, it's women are more elusive, right? They're not as easier to read as men.
Do you mean that
In a good way. In a good way.
Yes.
The bad part of that is that their symptoms are ignored. Because for males, I have chest pain. Okay, this is what we do.
Your standard
Your
heart
standard
attack.
chest pain. For women, it could be anything. I am tired. I have brain fog. I have dizziness. I have indigestion. Anything is fair game because their symptoms don't present the same way and then they get neglected and ignored. So my rule of thumb is if you are post-menopausal, I'm going to take you a little bit more seriously. Of course, you're not going to panic with a 20-year-old female who's healthy and says she has a headache. That's not going to be heart disease. But if you're in your 50s, I would start to wake up and get your screening done and get your tests done so you could be preventative, so you can catch something before it's a problem. The last thing I want to do is see you in the hospital and have to take care of an emergency that we could have treated if we prevented it 5 years ago. So for the women listeners, don't neglect yourself with this in this part of your health. I see a lot of women bring their husbands and they focus on their husbands. And then I'm like, well, what about you? You need your appointment as well. So let's book you. And then sometimes we'll find something that we would have not expected. And that's exciting to make that kind of a difference when you didn't expect it. So women need to be checked out just as much as men.
You brought up such a good point. Women are the last to get treated for this debilitating disease of heart disease. They put themselves last. So, some of their symptoms of chest pain, substernal chest pain, as we know, when we see this, we think, oh, you're having a heart attack, or left radiating. It's the pain is radiating to the left arm. That's not standard for women. Quite often women are just tired. And one day they just collapse.
Right.
And it feels like that's kind of the whole story. Our heart is it's almost like a heartbreak for women. Like, why are women's hearts breaking so easily? What's going on here? Is it a real thing?
It's absolutely a real thing. There is a heartbreak diagnosis, and that is well understood now that if you have an extreme trauma from anything, a death in the family, an argument with your spouse or your kids, or anything that just sets you off and is extreme trauma, you can have heart failure. You can actually have your heart break, and it can not function the same way. And sometimes that's not even symptomatic. It may baffle you. You'll just feel tired, but really your heart's failing. How crazy is that? Your heart's failing and you just feel tired because the warning symptoms are not very good. And that's why I say if you feel off, get checked out. It doesn't hurt you to get checked out. The more data you have, the better, right? So it hurts me when I see that the women population sometimes ignore themselves, neglect themselves. And if they don't have those hardcore symptoms that a man has, then it's not worth looking into. That's just not true. We're just designed differently, and you deserve the equal amount of respect to look into it. So I always make it a rule that if a female's coming to see me with her husband and the husband's my patient, I make the female mandatory, or I won't see the husband again. Like, you have to get checked out too. Why? Because one, you're taking care of your husband. If something happens to you, for sure this guy is not going to take care of himself the same way. Okay? So
Yes.
You're very important for your husband's sake and for your sake.
Yeah.
So that's a rule. You're not going to see me unless you come as a couple.
I love that.
Yeah.
I love that. That's amazing. From PMS to perimenopause to menopause to postmenopause, I've lived through it all. And through every stage, one thing becomes clear. Hormone fluctuations change how our bodies regulate temperature, especially at night. When your body overheats, even slightly, it disrupts deep, restorative sleep. The kind of sleep your hormones, metabolism, and mood depend on. That's why I can't live without my Rani lounge pajamas. Their advanced technology activates natural fibers, making the fabric moisture resistant, naturally fresh, and ultra breathable, allowing your body to stay cool and regulate temperature the way nature intended. Better temperature control means deeper sleep sleep, better recovery, and a body that feels truly at ease. Whether at home or traveling, staying cool, fresh, and comfortable has never felt so effortless. Go to RaniLounge.com, that's RaniLounge.com, and use my code HealthyDog15 and get 15% off your first order and experience sleep the way it was meant to be. We're going to shift into something a little bit controversial.
Okay.
And one of it is there's long COVID, which I don't think is controversial, and then there's vaccine injured. There's a doctor by the name of Dr. Asim Malhotra. He's from the UK. He's a UK cardiologist. I don't know if you've heard of him. He was really happy at the beginning of COVID to prescribe the vaccines, and then in 2022 published a study on COVID vaccine related injury and cardiomyopathy.
Yep.
Can you talk a little bit about that? Have you seen anything?
We've seen a
in your
lot
practice?
together. You and I have seen a lot.
I know.
More than we want to admit.
More than we want to admit.
Unbelievable.
Yeah.
So I have to admit this. I don't really tell people to get the vaccine anymore. I get that question, I think, every day. Should I get this third vaccine, fourth vaccine, fifth? Every year it's going to come out, a new vaccine. And I really think now that COVID is in the past, it's more background noise now. I would not recommend getting a vaccine every year or even getting a vaccine ever again. Sadly, I've had a lot of healthy young patients who've had chronic chest pain and chronic heart pericarditis, myocarditis from the vaccine. And it's so hard to treat because it's not something we have the armamentarium to treat to begin with. So we're stuck watching patients suffer from chest pain and heart failure from a vaccine that they didn't necessarily need. So yes, we're learning that the vaccines are not necessarily perfectly designed and they can actually hurt you if you don't need it. So I am at a place in my career and in my life where I'm telling my patients not to get the vaccine anymore. Maybe 5 years ago, one thing, but not today.
Right.
Just not. I mean, I've been very heavily busy in the hospital, and I haven't seen in the last 2 years really anything significant from COVID. I have maybe a few handful of patients every year with COVID, and they get their treatment and they're just fine. And I have not had anyone die in the last 2 years from a COVID-related death, right? Maybe from something else, and then COVID would happen to be there, but not from COVID alone. So I think the dust has settled there. I don't think we should panic every time you hear the word COVID and it's a death sentence and I have to get treated or I have to get the vaccine. I think it's in the past at this point, and I don't want to see people have health-related issues from these vaccines we don't know enough about, if that makes sense.
It definitely makes sense. And, we're not seeing any deaths from COVID. Now we're going to, pivot to COVID, long COVID, which you and I have been working on so many patients together and have seen some pretty incredible traumatic, damage to the body from COVID, measuring markers like D-dimer and the spike protein and correlating that to a patient's, post-COVID, or we call it long COVID journey. Can you talk to me a bit about that?
I'm actually very proud of you for this because you're one of the trailblazers who've put a lot of emphasis into this. Not many people have cared enough to treat this. And you've really concocted a wonderful treatment cocktail that I've sent my own patients for that I admit I couldn't do anything for. I'm like, I have nothing for you. I don't know how to treat this, and I don't think there's anything that you can do. And then I've, long shot, taken a chance and sent them to you. And we've had a handful of patients who've done very well and have thanked us that you have found a way to reduce inflammation levels and block this long COVID so that patients can have a normal life again. So I commend you on that. You did a really good job studying it and finding out what works and what doesn't work. And now it's available. So for any patients that need help and don't know where to go and don't know who to turn to, Dr. Nigma has, I think, perfected a regimen that will take care of the long COVID symptoms. Because if you don't, it lingers for 6 months, a year, 2 years. It's debilitating and you just can't function. It's awful. And it's really sad that, yes, we have great treatments for acute COVID if you have an infection, but what do you do afterwards? And nobody's really focused on that. Nobody's really cared to study that. We were not prepared for that. We didn't know that that would even happen. But there's people like you who care and who take the time and study this and have found a nice cocktail that I think works wonders and has worked wonders for my own patients. So I'm thankful for you to saving me because I didn't know what to do for them.
Warms my heart.
Yeah. So
Thank you.
That's why I love working with you.
I know. I love working with you too because, you know, when I see patients in their 40s or, you know, in their early 30s and, you know, I'm not sure what's going on because they've had COVID and I've measured their spike protein. I know that you're going to rule out pericarditis, which you were able to do with one patient that we suspected, and lo and behold, it was there. And, you know, we teamed up to help that patient. It was incredible, you know. So I feel like this kind of marriage of naturopathic medicine and the conventional healthcare model, we need more doctors.
We need more
like
union.
You. Yeah,
it's not a competition. It's a unionization where we work together and offer the strengths of what each of us bring to the table. And you got to put your ego aside and you got to know who to go to. And when you have the right team behind you, miracles do happen. I mean, we've seen people change lives. Incredible, you know. When I even lost hope, I'm like, I don't know if, you know, there's much we can do, but I have seen things that I didn't think were possible. And so, you know, I thank you personally for some of the great work you've done. And it makes my job a lot easier, you know. So everyone should hear this. Everyone should know this, you know. There are few people like you that really give their life to their patients. I mean, you become a friend to your patients. I've never seen this before, where you make yourself available and you follow up more than most people do. And you really give yourself. I know you can't see everybody and we have to be very selective with who we give our time to, but the people you do work with, you give it all. And that's why I'm your patient also, right? I also see you.
I'm gonna
I get
cry.
my detox with you. So thank you for what you do.
Thank you, Dr. Filsoof. It warms my heart really, truly, because I went into this profession to help people, to heal people. And I've just been so fortunate to work with people like you. And it honestly is such a blessing. And I can't wait for us to do more of it.
Absolutely.
I want to share something that could literally slow down how you age, inside and out. Let's talk about hyperbaric oxygen therapy, or HBOT. You've probably heard of it being used for athletes or wound healing, but what you may not know is the latest research is showing powerful benefits for cellular regeneration, brain health, and even reversing some biological markers of aging. Hyperbaric chamber works where you breathe in oxygen at higher than normal pressure. This process stimulates your tissues with oxygen and beyond what your body can normally get in. That extra oxygen jumpstarts your cells, helps natural repair processes, reduces inflammation, and boosts collagen production. It even stimulates the growth of new blood vessels. Studies have shown improvements in telomere length, which are kind of like protective caps on your DNA that shorten as you age. Longer telomeres, that's linked to healthier aging. If you're feeling the effects of aging, maybe it's slower recovery, brain fog, or skin that's lost its luster and glow, hyperbaric oxygen might be a powerful tool to help you feel sharper, stronger, and more vibrant. Go to oxyhealth.com, that's OXYHEALTH.com, and type in discount code HEALTHYDOC10 for your first order. I wanted to talk to you about something super fun, oxygen related.
Okay.
Have you done hyperbaric oxygen before?
I've never done it on myself.
Have you not?
I need to. We need
Oh
to
my
do
God,
this.
you've got to come over. I have a chamber at home.
We're going to make it happen.
The only problem is this dog is going to want to go in with you. So if you try to get into the chamber, he's going to try to crawl in the chamber.
We'll make an
with you.
exception.
So I've been using mild hyperbaric oxygen, and it's FDA,
Yeah.
guaranteed chamber. It's not one of those, chambers that are made somewhere else in the world and you're not sure what's in it.
Yeah.
I've been using it on patients, and patients have been purchasing it for their homes, and they've been fine. I've rechecked their IL-6 and their HSCRP, inflammatory markers. I tried everything else, and then I said, okay, let's do the hyperbaric every day for like 40 minutes. And I'm seeing incredible drastic reduction because it makes sense because you're getting oxygen, right? Pressurized into the plasma because red blood cells normally carry the oxygen.
They can only carry so much too.
Right? They're like, they're exhausted carrying so much, but
Right.
now it's in the plasma and now it goes to all the areas
That is harder to reach.
that's harder to reach, that microcirculation. So
You're going to see a lot of development with this. It's going to become big. It's not mainstream yet, and it's not easy to find. So
Right.
the fact that you have it is a win. It's a plus. I'm only aware of a few places in our town that even has it. But it's very good for wound healing. Very big for wound
Right.
healing. Very good for reducing inflammation, promoting longevity, anti-aging. I think we're going to hear more and more about this. And I love that you're avant-garde and you're ahead of the game and you already have something like this. I think it's huge. I think in my field, it's going to help with microvascular ischemia.
yes.
The hardening of the small arteries you can't see that still cause a ton of chest pain and we can't really treat very well. So I think we're going to see it for that a lot.
For angiogenesis.
Angiogenesis, regrowth of new blood cells, new arteries. I think it'll have a role for heart failure as well, maybe even for kidney disease. I think it's going to serve a very large role that we're not aware of yet. So stay tuned for that. That's exciting.
That's going to be interesting. And the fact that you can have it in your own house, I think taking the burden off the healthcare system right now, or sick care system, we want to call it, is I think some of the most important, and taking the burden off you as a doctor, like how must it be
Take
affecting
your health in your own hands.
Yes.
Right?
So
So anything you can do at home is a plus.
it's a total plus. Question for you. Have you heard of the 5, I want to end with this. I always end with this.
Yeah.
Have you heard of the 5 love languages?
Uh-oh. You got to educate me on that one.
Really? You haven't heard of? Okay. So there's, oh my gosh, I hope I remember them now. Okay. There's words of affirmation.
Okay.
So somebody's saying, oh, David is so amazing.
Beautiful.
There's touch, like to be
Physical
hugged,
touch, very
physical
important.
touch. There's gifts. And there's, what else is there? Acts of service.
Acts of kindness, acts of service. Yeah. Doing it
Yes.
for others. Yeah.
Which one would you say you are? Or which one would you say that makes you for you?
I'm
Do you
very
like getting
acts of
gifts?
service for other people gives me a great deal of joy. So
But for you, yeah.
that does something for me. I don't know. A lot of my patients are like, how can I repay you? And I'm like, your success is my success. It really makes me proud when my patients are doing well. That's my life work. So if I'm not doing my job correctly, it reflects on my patients. And then I'm not a good doctor. So my oath is to take care of people. So if I see people doing well, that is the greatest gift that I can receive. That's, I always told myself to be the type of doctor I would want to send my own mom or dad to.
Yes.
So I don't like shortcuts. I don't like shortchanging patients. I really give it all. And it really takes a lot out of me. I get exhausted at the end of the day. And it really, you have to really put in that effort. And it's hard to do that every day. But you deserve that as a patient. If someone's coming to see me specifically, then they deserve the best out of me. I think Kobe Bryant said it really well. He said, even if I'm sick, I have to play my best at a game because someone's coming to see me play. And who knows if they're going to see me again? Who knows the next time they're going to see me play? So I have to give it my all every day because my fans deserve that of me. I think that's the same way when I practice. If you're making an appointment to see me, you're taking time out of your day. That's an honor to me. And so I owe it to my patients to give them the best I can give them, and be truthful, honest, and go all the way.
That's amazing. Every doctor should be like you. I really
you.
think they
That's-
should. If every doctor was like you, we would be in such a different place. And I want to give you a gift before you leave. I don't know if if you can guess what it's going to be.
Surprise me.
Really? You ready?
Ready.
Okay. Remember, it's acts of gifts, acts of
Acts of
this is
kind.
the act of service as well, because I'm going to go over this with you. I'm
Okay.
going to give you a stool test,
Okay.
a poop test.
These are good. Yeah.
Okay,
Yeah.
good. I'm glad you have this reaction to it because some people have not reacted
Absolutely.
very well. So it's a 3-day stool
Okay.
collection kit, and it's going to tell me who's living in your gut
Mm-hmm.
microbiome. I want to take care of your gut microbiome because you take care of so many people, and it's going to tell me who's living there, the good, the bad, the
And
ugly,
yeah.
and really, this is.
Careful what we find. Oh my God, this is
Stay tuned for what we
Yeah.
find in Dr. Filsoof's gut. But it's a really important way of assessing,
absolutely.
overall health.
Yeah.
When you have your gut healthy, everything
You
else
did
falls
something
into-
on that. How to tell who you are from your stool.
Yes,
It was something
poop
you did.
types,
Yeah,
yes.
poop type. What is your poop type? Very interesting and
Yes.
actually very important, believe it or not.
Right. I hope it's not porridge
Yeah.
poop type, but, because then that's depletion of all the
We'll
nutrients.
decide on a good day.
Well,
when to
yeah,
do this.
have a good poop
Have a good day.
and then we'll revert back. And so
Thank
this
you
is my
so
gift
much.
to you
Thank
and
you.
some goodies for you.
Beautiful.
Thank you, David, for being here.
Lots of love to you.
Lots of love to you. Where can people find you if they want to find you on Instagram and your website?
If you Google my name, you'll find everything. Just put my name in Google and it's all there. Not hard to find.
David
And-
Filsoof.
Yeah.
And then your Instagram is
Same thing. Beverly Hills Cardiovascular for our office. David Filsoof for my personal. Just check out our website. I think there's a lot of good things on our website. We have a lot of testimonials and a lot of blogs I wrote in the past are on there. And we keep trying to update that as much as possible. So there's some good stuff on there. And just reach out anytime.
What
Ask
is
us
your
questions.
website?
BeverlyHillsCardiovascular.com.
okay. BeverlyHillsCardiovascular.com.
Very easy.
Okay. Thank you again so
Thank
much for
you.
being here.
A pleasure.